You are now viewing the fourth of 5 segments on using the Tegaderm CHG IV securement dressing. This segment is titled Tegaderm CHG Dressing Change. You should change a dressing if you notice any of the following: if there is visible drainage outside the gel pad, if the dressing becomes loose, soiled, or compromised in any way, if the site is obscured and no longer visible, if the dressing appears to be saturated or overly swollen, or every 7 days or according to your facility protocol if more frequent. So, what does it mean when the gel pad is swollen, and how does the Tegaderm CHG gel pad absorb fluids? The gel pad has a high capacity to absorb fluid, and it retains the fluid in the pad. However, the gel pad absorbs fluids slowly. As the gel pad absorbs, it will expand, but the dressing will not tent. It will remain in contact with the skin and catheter. As the gel pad absorbs fluids, the integrity of the gel pad changes and becomes more jelly-like. When this happens, the dressing is still providing antimicrobial activity, but it can become more difficult to remove and can lead to maceration around the insertion site. So, how do you know when the gel pad is overly swollen? To test if the dressing is fully saturated, lightly press down a corner of the gel pad with your finger. Remove your finger. Did the corner bounce back, becoming square again, or did the dent remain? If the gel pad remains displaced once your finger is removed, the dressing should be changed. You may see this happen more frequently in patients that are more active or are in hot and humid climates, or patients who bathe or shower without properly protecting the IV site. Educate your patients about what to look for and signs that their dressing needs to be changed. As part of your daily site assessment, the Tegaderm CHG dressing gel pad should be evaluated for signs of oversaturation. In review, how do I know when to change the dressing? When you cannot visualize the insertion site, when the blood or body fluid has gone outside the edges of the gel pad, when the integrity of the dressing is compromised. Also, change the dressing when the gel pad is oversaturated. Like a baby that needs its diaper changed, you need to check the gel pad to be sure it is not oversaturated. A diaper may be able to absorb a gallon of liquid, but that doesn't mean that it should. You would want to prevent skin irritation and change the diaper. Like the diaper, the Tegaderm CHG gel pad can absorb a lot of fluid and may become oversaturated. You need to inspect the Tegaderm CHG dressing during your daily site assessment to determine if the gel pad is saturated and needs to be changed. Or change the dressing every 7 days or according to your facility protocol.